Imagine I've been writing questions for 25 years. I write questions for the boards. I write questions for all manner of things. So it takes a lot of experience to really be an expert at it. But today I'm going to try to give you the basic format and some rationale and some tips to consider when you're writing multiple choice questions. So my first question to all of you is, well, why would you use multiple choice questions to begin with? What are the advantages of multiple choice questions?
Grade.
Easier to grade.
Have no,
What?
I have no choice.
You have no choice, okay.
Year 2 requires that we write multiple choice.
Okay.
I would rather have an essay, short answer.
Well, you should take my course on assessment and we can talk about why one might be better in some circumstances than others. Okay, anything else?
Multiple choice, like I think like you kind of like do brain exercise to include and exclude. That what my thing is like when we have multiple question, I think I get my brain exercise, like why I'm excluding this, I should have a reason why I'm including the answer. So there's something for learning purposes.
Okay. So basically the big three are one, versatility, right? They can be very practical. You can ask a ton of questions in one single assessment tool. You need much less resources for grading or for statistical analysis with multiple choice questions. Because you can write so many in a single exam, then they are generally very reliable and very valid if you have enough questions. And they're probably the easiest ones to write to give you reliability and validity. With the caveat that you can write bad multiple choice questions that aren't reliable and aren't valid, and you can write them that aren't objective like they appear to be, because it depends on the selection of the stem and the selection of the options. So if you have a very idiosyncratic view of something and you're writing the test, you can put enough bias in it that people will get it wrong. So they're not necessarily perfectly objective all the time. Disadvantages, students have the ability to guess, right? Because you got 5 options or whatever. So you get a 1 in 5 chance. Constructing them can be difficult. Exposing students to false information, what the NBME calls lures or distractors, can cause interference, which might not have happened if you just asked them a question and looked for the answer. So you get students in trouble who do a lot of second guessing and overthinking kinds of stuff. They don't allow for individual interpretation as well. So you have to be it's very constricted question. It doesn't allow you to think broadly. However, there are some misperceptions. Multiple choice questions do not have to only test rote memory. Fast ones don't test rote memory, they test application. They are not easier than written answers because if you make the real national boards questions, when we write national boards questions, those suckers are difficult to answer because they have one correct answer, but some that are certainly plausible and none that are completely implausible, right? It's not like you're taking the bloodborne pathogen and it says, all of the following are true, and then it has one that says, the sun rises in the east, or it has some, implausible ones that you can guess. So how do you start to write multiple choice question? Well, you need to figure out what your learning outcome is first. So what is the goal and or objective of whatever content it is that you want to be testing? Okay, you're not going to just write questions about motorcycle maintenance in a biochem class, right? So you need to think about what it is, what are you trying to test? What thing do you want to test? Then you're going to think about how you want to construct the question. The question itself is called the stem. Then you're gonna think about your alternative answers, distractors or lures. And then you need to think about, as you tweak it, what level of thinking do you want to assess? So the classic ones for anatomy multiple choice questions are, this muscle moves the index finger of the right hand. Okay, that's pure recall, right? But a question like, you injure your hand and can no longer do this kind of movement that requires that, what muscle is it, is another level of abstraction or application. So you can get at multiple levels. So why do you write multiple choice tests to begin with? Well, you're informing students about material that's important. That's why students like the SAQs in whatever form, good or bad, they're in, because you're trying to get an idea of what the level is. It can externally motivate students to study. You don't need to, I won't go into that because I don't think very highly of external motivation to study, but it does indeed do that in the short term. It can identify areas of deficiency or remediation or areas that you need further study. It can, of course, determine grades or make promotion decisions. And it can also identify areas in which instruction in the program could be improved. So, if everybody misses these 10 questions, there must be a problem with how the material is being delivered. All right, so how do you do this? Well, the sine qua non of multiple choice formats is one single best answer. And we talked about a little bit why that is, but basically one best answer item formats that require test takers to select a single best response is the best format. Now, the National Board has tried them all. And they have this huge, if you want to see Appendix C, there's NBME retired item formats, and they've tried everything. But the ones with the best statistics that best evaluate a learner's knowledge are one single best answer. Okay? Things that don't, any kind of questions that they're called C-type questions. So they have A, B, both, or neither. The boards doesn't allow them. I don't allow them because the boards doesn't allow them, and it's not a good way to teach, to do a test, because if you want to get both test savvy takers, there's a way to look at. You try A, if it's right, you try B, it's right, you try C, and it's right, then you know it's all of the above. You don't even have to go on to the rest, et cetera, et cetera. So you're decreasing the number of options, which then increases your capacity, your chance of guessing correctly. True false items, big no-no. Okay, and we'll get into in a minute why true false aren't a good idea. Generally, it's because the options aren't so the STEM is the question, the rest are the options. The options aren't homogeneous. And so I'll see true false question, which of the following is true? And then it'll have, rockets use propane, motorcycles use gas, the earth turns in a circle, and they're not homogeneous, right? And so you have to know way more than one concept to answer the question. And usually because of that, you get answers that are partially correct or equally correct. And it just statistically, it just doesn't test the best. Okay, so the one best answer family has options that are incorrect, but not necessarily wholly wrong. Right? So that's why the lead-in is always like, which of the following is the most likely diagnosis? So there's one that's clearly correct. There's another that might be correct, except for one or two things. And then there are three that are much less likely correct, because you usually get one or two good options, but the ones at the bottom get a little untenable. All right, another rule to think about is you should be able to cover the options, just read the stem and come up with the answer, which is why true, false don't work. Which of the following is true? How would you know, right? But if you're doing vignettes, which most of us are doing these days, you should be able to read the vignette and say what the answer is, and then find that answer in the options. Okay? That's a hard one, because to make it obvious what the answer is from the stem requires some skill. All your options should be homogeneous, which means they all have to be related to one another about whatever topic. So if you want to know what the spinocerebellar tract does, then you should only have options there about the spinocerebellar tract only. You should not throw in one about movement and throw in another about something else. They should all be homogeneous. So I won't get into that. You can actually write true false questions that are decent with homogeneous options, but I would just, you'd rather never write true false questions. Okay. Skip the true false. Okay, so there's all kinds of technical item flaws that will either make things too confusing for the test taker. So you're basically saying that the test taker has to understand what you want and how you've constructed it in order to understand the question. So that the stem is confusing or ambiguous, or like there's double negatives in there, all these things that basically make it, how well do you read convoluted English language? That should not be what you're testing unless you're in an English class, right? And you also, the other kind of flaw is the ones that give the answer away to test-wise students. And trust me, by the time medical students, they're test-wise, right? Because they've been through a lot of multiple choice questions. Okay, so here's a couple things not to do. Don't give long, complex options. The stem should be complex. The options should be simple, rather simple and homogeneous. Okay? Don't present numeric data inconsistently. So for example, after a second episode of infection, which of the following is the likelihood that a woman is infertile? A, less than 20%, B, 20 to 30%, C, greater than 50%, D, 75%, E, 90%. Right? So if you answer C, greater than 50%, you've already answered C, D, and E. Right? So if you're going to be a test savvy person, then you would probably pick C, right? So make them either mutually exclusive or all in the same format. Don't let things overlap. Also, don't use vague terms. I hate reading questions that there's a difference between has a 75 chance of clearing spontaneously versus often is related to endocrine disorders, usually responds dramatically, usually responds to pharmacotherapy and intensive psychotherapy. So don't use often, don't use usually, unless you're going to quantify it more than that, because my often might be different than your often. Several might be different, might be 2, 3, 4, depending on who you are. So don't use vague terms. Don't use none of the above. This one drives me nuts. Okay, do not use none of the above. It's problematic in items for which judgment is involved, because the options aren't absolutely true or false. So, I mean, if you happen to get 4 options that were absolutely, absolutely, absolutely false, 100% of the time, and then you wanted to do a none of the above, you could do it. But they're almost never one or the other.
Save that for health stream training.
A lot, right? And so there is this particular example has an item that is a very, very long stem about a newborn and his growth, et cetera. And it ends with which of the following is the most appropriate pharmacotherapy? And then it has citalopram, lorazepam, morphine, naloxone, or none of the above. Right? And if you read it, several of these medications could theoretically be used. They wouldn't be your first line, they could be theoretically used. So just don't use all of the above, because all of the above, all you have to do is find 2 that are right, and you know all of the above is the answer. Right? So don't use none of the above or all of the above. Don't use non-parallel, we talked about before, options. You often see these in true false ones. So which of the following statements concerning these results is correct? The number of cases is too small for statistically meaningful conclusions. Vaccine efficacy is calculated as 85 minus 15 over 100. No conclusions can be drawn because the trial involved only boys. Very non-homogeneous options.
How about one where the best answer provided isn't the best answer in reality?
You shouldn't do that.
But so a case on the most recent exam was that you were treating for a TI and you gave ceftriaxone, but in reality, chlorpheniramine would be given more, but that wasn't an option. Though ceftriaxone is from my understanding, a fine, good option, it's just not usually what is the first line option.
I wouldn't do that. Back to way back at the beginning, I talked about, don't write questions that confuse people about what really is true. So don't ever put a lure in that's not true. Say a medication's, unless the question is about the medication's action. Don't put in a distractor that's just completely spurious. Likewise, don't put in, if there really is a best answer and it's not in the choices, I wouldn't ask that question.
Make it better.
I mean, you might want to say, and you could fix it by saying, in the STEM, you know that ceftriaxone is clearly the right medication, but it's not available. Which of the following would you use?
Just adjust it and say that.
That's
I have a
important.
concern for tendon rupture, so which of these is the best option?
Right. So if there is one that you're not putting there, then tell the student there is one that you're not putting there. That's the
Okay.
best.
Okay.
Otherwise, they're going to think they've gone nuts and they can't find the right answer. Okay. Okay. So now let's talk about negatively phrased lead-ins. I hate this one too. Each of the following statements about cholesterol is true, except.
Oh my God, I got so confused.
Don't use that. Because this one is wrong in 2 ways. It's a true false question, and then you're asking it in the negative. All that is an exercise in how well do you read the English language.
I have to tell my brain what to look for.
Right. They drive me crazy too. Don't do that.
That's why I don't like to. Ask me a question and I will write you an answer.
If only it were that easy. They're not as reliable, and that's why we don't use them for pure content. That doesn't mean that it wouldn't be a good idea to use them sometimes.
Well, for graduate teaching, it's a little bit.
Yeah. Okay. Now those are all the ones that will confuse people, so don't use them. Now there's a bunch that cue the test-wise examinee. So don't give grammatical cues. So, for example, This is a little vignette, and then it ends with, her diagnosis is most likely to be an A, asthma attack, B, costochondritis, C, pleurisy, D, rib fracture secondary to coughing, E, viral pneumonitis. But you said N. Yeah, so you just told the student which one's the right answer. Okay, they shouldn't know the right answer because you wrote the test wrong. That's not a valid choice. Okay.
So is that one just like A and, you just put a little slash in the question mark? If it's,
Yep.
if it takes.
Yep,
Like,
that's
no,
all it
like, if
takes.
there's like, is it R, so just put is/R.
Yep. Don't use collectively exhaustive options. So here's one, administration of furosemide results in, which by the way is wrong too, for a minute. In a minute, I'll tell you why that one's wrong. A decrease in potassium, B, an increase in potassium, C, improved glucose control, D, no change in urine potassium, E, requires decreasing the dose with renal failure. You've got no change in potassium, an increase in potassium, and a decrease in potassium. One of those three is the right answer, right? Because you've got a collectively exhaustive group. So a savvy test taker would see that and get an option, 5 options down to 3 immediately. Don't use absolute terms. So don't say things like is never seen, is never severe. A test-wise student will eliminate those options because it's less likely to be true that something is never than something is, could be or can be or possibly, etc. All right, so
That's
don't,
true for always.
what do you mean?
Something is always something.
Yes.
Yeah.
Yes,
Should be a class for take tests. Well, other people make those mistakes. You get questions like that.
well, yes, but what happens is when you're writing questions for the boards knows that,
Yeah.
like a test savvy student will pick the longest option as the answer. So we'll on purpose write one that's long.
Okay, so just
That's not the
people
answer.
I'm ever gonna test. I'm gonna use these.
Well, test savvy people will,
I don't
yeah,
think
but
I'm
you're not,
Now I
well, you are here, so, let's see. Correct option stands out. This one is actually what I just said. If one is very much longer than the other, if one has 2 sentences and all the rest have one, if one has a question mark and all the others have periods, that kind of stuff. If you stand one out, it's more likely than that's the correct answer. Unless you know that and then don't do it that way, which is basically being test savvy back, which is kind of cruel. So in the boards, what we'll do is we'll make sure that they're balanced. There's, 2 question marks and 3 periods. They're all 2 sentences kinds of stuff. Don't use word repetition. We call them clang cues. So for example, in the stem, it says he speaks of experiencing the world as unreal. Which of the following best describes this symptom? A, depersonalization, B, derailment, C, derealization, D, focal memory deficit, and E, signal anxiety. So you've said the world is unreal, and in the stem and in the options, you've said derealization. So you're cueing a test savvy student about that. Okay. You don't need to know that one, that's too hard. Okay, so what I'd like you to do is pick a topic. I don't care what the topic is. And start writing a question. And we'll give you 10 minutes to do it. And you can either put in something obvious that's a flaw, so you can say, ha ha, this is a flaw, I did it on purpose this way, or you can really try to write a good one. It's up to you. And you don't have to write it about science if you don't want to. Write anything you want.
In the meantime, any questions from the WebEx participants? Please put that in the chat if you wish. On to you.
And for those that weren't here when I first got here, I'm going to be emailing you a PDF file of the National Board's item writing guide, which has everything I've discussed and more, including things like test analysis and writing clinical vignettes and et cetera, et cetera, et cetera. So, because we're not going to get to all that in an hour.
Sure.
We're gonna give everybody a shot, so don't feel like I'm picking on you. I'm just picking on you first.
Okay. Well, the answer, but at SUNY Downstate, Humidor residents rotate at 5 hospital sites. At which hospital do residents take overnight call? Kings County, St. John's Hospital, Staten Island University Hospital, VA, and University Hospital at Downstate.
Okay, so what was good about this question and what was bad about this question?
Options are like closer to each other. Like
Yeah,
it's not like you're
come on.
talking about this hospital or some other program or like school, they are like on.
Yep. What was bad about this question?
Root memorization.
Rote memorization.
I made it a savvy test taker one so that I did do something wrong that I, like, you should be able to figure out the answer based on one of the little test taking strategies. Like, I highlighted it.
Oh,
for
you said downstate twice.
Yeah, like.
So downstate twice, okay.
That was the thing I cued in the question at SUNY Downstate, and then the answer was University Hospital at Downstate.
I missed that.
I think there's a difference between hearing it.
Yeah.
And
Okay.
reading it.
You read it and you're like,
There definitely is. It's easier to spot when it's
That's right.
written. Yep. Brandon, you want to take a shot at it?
Sure. A genetically modified mouse overexpresses the XY gene in all cells. While using the mouse for your research, you observe that the mice have an altered gait and lack balance. What characteristic, or this characteristic is called what? Genotype, phenotype, nucleotype, or haplotype?
So what's wrong about that question? What's right about that question? What's right about that question?
Homogeneous option,
Homogeneous options.
which I didn't have at first and I changed it. I had one, a genetic trait.
Uh-huh.
I was like, oh, that one you can.
What's wrong about it? Did you write something on purpose to be wrong about it?
No.
Okay, so the only thing wrong about it is something that I forgot to tell you. I should, is the lead-in, the last lead-in before the options always should be a full sentence. Which of the following is the correct term
For
for
this
this condition?
Okay.
Okay, don't say, which of the following is, question mark.
I said this characteristic is called what?
Yeah, so I would say this characteristic is called which of the following.
Here's the part. Okay.
Always have it a full sentence. Okay, Boyan, did you write one? You didn't, okay. Michael, you want to give it a shot?
Okay, so, a group of men celebrating their 50th high school reunion traveled together to Vegas for a poker tournament. 3 of the 6 men returned home and immediately go to urgent care with breathing issues. The gram stain reveals a coccus bacteria that is neither gram positive or gram negative, which bacteria is the most likely source of the infection. So Staph aureus, strep pneumo, mycoplasma pneumoniae, Acetobacter pneumoniae, and then a 5th one I haven't written down yet.
Okay, well, you can leave it for.
Nocardia, yeah, nocardia.
So what's right about that question?
It's straightforward.
yeah, like straightforward question, give the rest of the information we need to answer. Options are like
Homogeneous.
homogeneous. So we're talking about some parasite or virus and bacteria.
Yep. What's wrong about that question? Really nothing. Although if you wanted to be, unless you're cueing something that I didn't pick up.
Oh, you don't do sketchy, so that's the.
Yeah, I don't do.
So this is more the stabby test writers style. 'Cause the answer is not nocardia, but the setup is the picture that they look for nocardia.
Yeah.
Old men playing cards is nocardia.
Oh, that's funny. I was gonna say, if you wanted to be, if you want to be really picky about it, you probably don't need that first sentence that 6 men went to Vegas,
Yeah.
right? It's just
There
making.
should be like something which leads to
You
like.
could just say three men came back from Vegas with this.
Yeah.
Instead of, needing an extra sentence. Now, sometimes you put them in because they're amusing, or you put them in to give you more context, and that's fine if it's one sentence. What I don't like is what Carl used to do all the time, and he would name his patient or the doctor like something funny. And that's fine, but it's distracting. People are gonna, savvy test takers are gonna look for meaning in the particular word. You just don't need it. So one thing to think about when you're writing test questions is you don't make them any more complicated than they need to be. You don't, when you think of a vignette, you don't have to make it a paragraph long. Because remember that student test takers are timed when they take these things. So the more you make them read super long vignettes, the less time they have to actually think about the answers. So typically when I write questions for step 1 or step 3, they're 5 sentences long, maybe. Not much longer than that. Some of the medicine ones get a lot longer when you start throwing in a whole bunch of labs and stuff that you need. But I'm writing communication questions and behavioral science and psychiatry questions, so you generally don't need a lot of that. All right, Aisha.
Yes, it's like a medical question. The little lengthy, I tried to write some like case scenario. So a 16-year-old patient came to the ED with complaint of multiple episodes of vomiting since last 2 days. My vomitings were bloody, non-bilious. He reported no fever, no cough, congestion, runny nose. On exam, patient has dry mouth, gap refill, 4 seconds, mild epigastric tenderness. On auscultation, normal S1, S2, lung exam was normal. Labs were obtained, which showed normal CBC, electrolytes were normal. Creatinine was 1.2, liver functions normal, UDS positive for THC. Patient was made NPO, started on IV fluids, given Zofran. Patient was transferred to the pediatric floor. Patient continued to have vomiting after a few hours. Nurse complained that patient started complaining of some chest pain. Which of the following tests would lead to the diagnosis of patient recent complaint? 1. EKG. 2. Chest X-ray. 3. Troponins. 4. Viral PCR. 5th. Echo.
So what's good about that question?
It's a good stem, like for context.
It's an interesting stem, right?
You have to really think and put the pieces together.
Right, so it's an upper level knowledge analysis question. Yep. The options are very homogeneous. They're all tests of one kind or another. Right? What's wrong about it?
Seems overly complicated, but maybe you need all those details to answer.
I don't think it's overly complicated, but it is overly long. You could, if you want to be really picky, only use the sentences that you absolutely need. And so if you say, you could say cardiac, heart, this are all normal. And the other one is if you're going to present physical exam findings, always present vital signs. Okay, which I didn't mention, but it's a board stickler thing. What's the right answer?
Chest X-ray. Because this patient, like, I just want the thing, like, at multiple episodes of vomiting, then THC is positive. So marijuana induced vomiting. It can lead to like intractable retching. Patients have epigastric pain. So there was some tender, but there was no chest pain, and then certain onset of chest pain. That's why I mentioned earlier, like lung and heart exam was normal. So there was nothing initially. So cardiac is essentially ruled out initially. So it's this patient has poor health, like because of retching and vomiting, esophageal tear, and then that's what patient has. So that's why I put all these things in the exam to, you can, if you are really viral PCR, like patients know you are a symptom, so you don't have pericarditis or myocarditis, you just exclude those things by reading the stem. So you have the right answer. If you're closely following the pattern, then you get X-ray.
That would be a step 3 question.
Because it would have, because like I got to the marijuana induced vomiting, but then all that stuff though was the initial presentation. Wouldn't you need like a new presentation? Because the chest X-ray thing is for, like, not for his initial complaint.
No, that's why I for recent complaint. My question was,
Recent, okay, then maybe that's kind of confusing, right? Recent complaint when the whole stem, like when you said recent complaint, I'm thinking like when he came in.
oh, maybe, yeah.
So you might want to say
Chest pain,
for
especially
a
chest
new
pain.
complaint
For
of
his
chest
chest
pain.
pain.
Maybe it's for chest. pain.
Yeah,
I should be
new-
very
yeah.
specific. yeah.
That's a good point. All right, you're up.
Okay, so I did a bad example, not science related.
I love it.
Okay, so basketball was invented in Canada in the late 1800s. All the following are rules in basketball except
Oh my God.
Well, we know what's wrong with this, but
A, players cannot run with the ball without dribbling. 2, defensive players cannot slap the hand of the dribbler. 3, a free throw is worth 1 point. And D, all of the following options are rules in the game of basketball.
I cannot process my brain is not functioning.
okay, so can you see when you hear it? I mean, that is a recall question, which should be easy. And we all know at least enough about basketball to have a guess or two, but you've completely made it unanswerable the way you wrote it. Right? And that's what well, you guys know, that's what you feel like when you hit one of these questions that it's like, wait, your brain goes this way and you can't do it.
So if it's all going except, then once you find one that's wrong, you stop, right? Wait, all of the following are rules except.
Except, which
So like
one's
once I
false?
find
found
one
a
that's
bad
wrong,
one,
like
yes,
stop.
You
Like,
can stop.
was it for-
Right, but then at the very end, he also said all of the, except, and then at the end, he put all of the following are rules, like all of the above. So maybe he's got an except and then an all of the above at the bottom, and it's just like,
Oh my God.
But we know it can't
Just
count.
exempted for you.
That doesn't even get to the NBA's
Yeah.
version of travel.
Yeah, sure.
So this exemptive, like when you have this kind of question, like sometimes they do come, like, I just leave it. Finish all my block, go to that question, then really try to
Go
think
back.
what they're trying to ask. I don't want to waste my brain and time and get frustrated on
Right,
that.
and that's why you don't write those kinds of questions, because you're testing the ability to read the question, not the concept. Although I know that you're not supposed to walk without dribbling, except I still don't get the guys who like they take these five humongous and then dunk it. It's like, wait a minute.
They were all rules. Yeah, so that was all of the above are true. They're all rules.
Oh, because you can't walk with the ball?
You cannot.
Do you-
My
Yeah,
brain is not processing.
So see, there's another, it's a double negative. Oh, look, we got a whole bunch of up there.
Oh,
too.
wow.
Hold on, we got one more person here and then we'll go.
Can you unhighlight it so we are not doing yes?
Yeah, but wait, we got one more here.
Okay,
Aisha.
doctor. Okay.
We have one more.
Okay, sorry. We're so excited.
Patient presents to the clinic with an unspecified infection. After testing, patient is determined to be Staph aureus. If the patient has a true penicillin allergy, which of the following would be the best treatment? Ceftriaxone, amoxicillin, clindamycin, or methicillin?
Okay. What are the options again?
Ceftriaxone, amoxicillin, clindamycin, or methicillin?
So what's right about that question?
Marcia's answers,
Yeah.
options.
Yes. Very concise and to the point that what she wants to ask is clear and the stem.
What's wrong about that question?
I thought you were asking how to treat the penicillin allergy, not
No,
to use instead of. Maybe I just misheard what you said.
Yeah.
But I was looking for epinephrine in there.
Okay, well, yeah. Whole different direction.
Yeah.
Right, what's wrong about this question is it's huge. It's got a penicillin allergy, but methicillin, and there was another
Then
psyllin
it's
in there.
oxalate, so you
Right.
just,
So you already know that those can't be right.
I like that question.
So that's a tricky one. Okay, but a test savvy student could get it down to two.
But isn't that what we're supposed to do?
No. We're not testing your test savvy ability. We're testing your knowledge about the content.
But my knowledge is what's gonna lead me to exclude two of the answers.
No, because it's not that kind of knowledge.
Okay.
It's NVMe knowledge,
Okay.
like that.
Switching minds.
I mean, it would be interesting to give you guys a test at the end with multiple choice questions and see how many you could answer
With
just
the
by being
strategy.
test savvy.
Yeah, that's what I'm
I could ask you some dressage questions to see.
Some skills.
Okay, I think we've got some up here to work through. Let's see what we got.
So Dr. Rodriguez, I would ask Dr. Olson to.
Which of the following are the most common causes of bacterial neonatal meningitis? Streptococcus pneumonia and E. coli. E. coli and group B strep, Staph aureus and group B strep. Neisseria meningitis and Streptococcus pneumoniae. Coagulates negative staph and Staph aureus.
Okay, so what's good about that question?
like straightforward.
Yeah, you have
ask
A
specific.
known issue,
Yeah,
right?
yeah, specific.
Known issue, homogeneous options.
Sort of. I don't like it as far as homogeneous options. You don't have the formatting of the bacteria isn't anywhere the same.
Well, that's
You have
true.
Abbreviations and you have partial abbreviations and
That's true.
coag negative staph.
But they both
I'm
have,
sure that the med students who just took HI.
but they have bug and bug, bug and bug,
Yes.
bug and bug. However, they have streptococcus in there twice
Staph twice.
and staph twice
And GBS twice.
and TBS twice. So GBS twice. So again, you're getting into, I'd much rather see you write two questions with one or the other. Just have one option, not two options for
Like E.
each.
coli, which is of our topmost diagnosis.
Yeah, because again, when you try to do that in your head, when you're taking an exam, you're gonna say, okay, it's an R, so I know there's two options, so there's two options everywhere, that's not gonna help me. But you're gonna end up in a game of here's strep and here's strep, but here's staph and here's staph, and I know one of it is staph, but the other, you're gonna go nutso trying to figure that out.
Dividing it into two questions make you identify the second most common. It just goes back to my.
Well, you could say staph is the most common, so what's the second
Second
most
most
common?
common.
Yes,
Then
you
if I
could.
had two questions, then I go back and change the answer to the other one, because I just gave it.
Well, yeah, that's
But
another thing you
They
don't
give
want
you
to
a
do.
different blocks, so you were like, oh my god, we did this in the previous.
If you're gonna do that, you want to separate them far away from each other. Because that's the other problem with questions that one builds on another, builds on another. If you get the first one incorrect, you're gonna get all of them incorrect. But if you get one of them correct, you can usually correct the other two. So again, those are manipulations of the language, not knowledge. Okay, let's try another one.
A 25-year-old patient presents to the clinic with complaints of tunnel vision, tingling sensation in their fingers, and seeing zigzag lines. The patient has not experienced this before. What would be the first line of treatment for this acutely? Hydrocodone, naproxen, oxycodone, topiramate, and
Lamotrigine.
something with an L.
Lamotrigine.
Okay, so what's good about this question?
The options are like, they are like different classes of medication.
Well, they're all meds, but there's
There's
different kinds.
two opioids in there.
Yeah, 2 opioids, 2 anti-seizure, or like, and 1 NSAIDs, naproxen.
Right, so if you go back to the stem, this person is not complaining of pain, right? So you could knock off 2 of them
3 of them.
3 of them quickly. And so then you're left with 2 anti-seizure drugs, so you're down to a 50-50% shot.
So rather.
Yeah, yeah.
Rather, you should do 5 seizure drugs. Or something that might treat an eye issue
Or migraine.
or migraine issue.
But I guess you could give naproxen for migraine.
Yeah, right.
Yeah.
So I wouldn't do migraine, but do something that looking at it might theoretically treat those complaints. Okay, okay, let's stop. If you've written a question and we haven't got to it, if you could please email it to me, I'd be happy to give you feedback on it.
Give me the last one.
Is it, no, there's multiple ones. We don't, we
There's
have,
2 or 3.
Let's have an adjustment.
Just one more.
It's
It's Dr. from Dr. Stout.
oh, we have just one more? Okay.
A 2-year-old girl presented with fever and limping for 2 days. MRI of the lower extremities showed evidence of osteomyelitis. Which empiric antibiotic therapy is appropriate for this case?
The last one, I think you added it.
Yeah.
It's the best choice in this case.
Yeah, best choice.
Which empiric antibiotic therapy is the best choice in this case? Clindamycin, vancomycin, cefazolin, ciprofloxacin, and azithromycin. Much easier words to.
Okay, and they're parallel. The only thing I would suggest is you're asking a question in your last sentence in the stem, so it should have a question mark. Which empiric antibiotic therapy is the best choice in this case? Question mark.
Is there a concern that 3 of them are mycins?
No.
Is that
Yeah, like different
triggering
classes.
the-
Clindamycin is totally different class. Vancomycin.
Well, it could trick, what's the right answer?
It's an osteomyelitis, cefazolin.
What do you think the right answer is?
Cefazolin.
Vancomycin?
No, cefazolin.
No, they said C.
Cefazolin.
Yeah, cefazolin is the best one. I change it from the if you use appropriate, there is couple ones you can use, but cefazolin is the best because of the age.
Because of the age.
Yeah, because you cover both two organism staph and Kengella, which is also common in this age. If it is appropriate, it could be like three appropriate answers, but the best choice will be cefazolin used because of the age of the patient.
Cipro, this was already out because we don't usually use it in the pediatric.
Okay, but if cefazolin is the right answer, then I don't like your options because the 3 mycins will cue away from a mycin. The only way it would work is if the right answer was actually one of the mycins. Otherwise, a test savvy student will get rid of all the mycins.
But there's, like you said, these are different classes.
Yeah, they're different.
I know, but a test savvy student will get rid of the mycins. For right or wrong, I'm not sure,
But I could see a scenario where one of those still could be right.
but I would just be careful about it when you're trying to write pure, clear, multiple choice questions. You want to make them as easy as possible in the English and in the logic of the question. You can make them as hard as possible in the options, as long as the options are homogeneous. Okay, and that there's not one right, and there has to be one right answer. And you can say which of the following is most likely, so it's not 100% absolute. And then they have to pick from like the gradation, which is the most. That's fine. That makes those harder. And those are all fine. But I hope through this, you guys have gotten a glimpse of, one, how easy it is for a test savvy student to do well. B, how difficult it is to write a good question with nothing wrong with it. Which is why, by the way, when we write questions for the boards, we write them, the NBME rewrites them per NBME language, and then we all sit in a big circle, 15 of us, and go through every single question. Because you get blind to your own question. All right, we got to stop. If you have any questions, please send them to me. It's just dclayman@siumed.edu. I've been around too long to have numbers.
Yes, I was like, you don't have numbers.
Thank you, everybody.
Thank you.
And this, if your name was not on the list of attendees, please send me an email saying that so